local exam organiser. This session's being recorded, so if you don't wish to have your face on the recording, you can probably just switch your video function off. So we'll get going. Next slide, please. Okay, this is an acknowledgement of country. So we acknowledge the traditional owners and custodians of the land in which we live and work, and we extend our respect to all Aboriginal, Torres Strait Islander and Māori people, and value the importance of their ongoing connection to land, sea, sky and community. We pay our deepest respects to elders past, present and emerging, and together we restate our shared commitment to advancing Aboriginal, Torres Strait Islander and Māori health and education as core business of the RACP. Next slide. This is just an overview of what we hope to get through today, and with regards to the adult examination. Next slide, please. So the purpose of the RACP Divisional Clinical Examination is to assess clinical skills, clinical acumen and interpersonal skills to inform whether trainees have reached the standard for completion of basic physician training to allow them to proceed to advanced training. Next slide. These are some key dates, which I'm sure you're all well aware of. Applications for the adult clinical exam opened on Friday, and to date, the last email, over 200 people have responded. The applications closed, and this is the most important, on 5 p.m. Monday, the 24th of March. Our exam dates go from Friday, the 6th of June to Sunday, the 22nd of June, and then Saturday, the 28th of June to Sunday, 29th of June this year. And the results are released on Monday, the 14th of July. Applications for special consideration. If it's pre-examination, then you need to submit a completed application form and supporting documents at the time of registration. Post-examination special consideration, you need to submit the completed application form and supporting documentation within 5 days after the individual's examination, not after the whole 3 weeks comes to an end. So that's 5 days after that individual's examination. Very important. Next slide, please. There are contingency plans in place should we need them in the event of a catastrophe or a pandemic. So plan A is that the exam will proceed as scheduled on the planned exam days using the planned delivery model. And plan B is that the exam will be rescheduled as soon as possible and impacted candidates may be reallocated to other local available examination sites. Next slide. The terms and conditions, once again, I urge all LEOs to get their candidates to read this carefully. They must raise procedural issues during the examination, either with a local exam organiser, the examiners when I'm presenting, the chief examiner or the RACP staff in Aotearoa on the day of the exam. You need to acknowledge that you've read and understood the special consideration assessment policy, the divisional clinical examinations information on the website, and the academic integrity and training policy as applicable to RACP examinations. it says here, I agree that the RACP may share my results and my feedback with my hospital's Director of Physician Paediatric Education and the education supervisors responsible for my supervision in training. And I understand that the RACP uses service providers under appropriate confidentiality clauses to deliver the examination and process and distribute results. And I understand that I'm not allowed to, and this is very important, remove examination materials from the venue, including questions, answers, notes, or any other material. Indeed, you cannot copy or reproduce, including reacting from memory, distribute or disclose any examination content during or after the examination. And the applications for the DCE are a declaration of the candidate's readiness to sit the examination. In post-examination applications for special consideration for assessment, previous conditions cannot be taken into consideration. Okay, next slide. The examination format. I'm sure most of you are very familiar with this. Long case, you have 2 cases over the day, 60 minutes of history taking, 10 minutes of note preparation, and 25 minutes of examination time. The examination team is always a NEP or senior examiner, a local examiner, plus or minus a provisional examiner. The short case is 2 minutes preparation outside the door reading the stem and 15 minutes of examination. Now, I've always advised people the 10 minutes of note preparation should probably be restricted to 9 minutes, with the last minute where the candidate is escorted to the door of the examination room, as this gives them the maximum benefit of 25 minutes of presentation and questioning. Next slide, please. So this is an examination day schedule for our examiners. So you'll find that most people get there between 7 and 20 past. And whoops. Keep going. And next, it'll be the next slide. Yes. And then good. So this is the candidate's schedule. And this is probably the most important one that the examination assistants will need to look at to help their candidates around. And then there's another timetable. Next slide. And this is including stem reading time and so on. So you can have a look at those at your own leisure. I won't go through them. Next slide, please. This is an important thing for long case selection. A suitable long case should provide several active or acute diagnostic or management problems, include other stable conditions requiring assessment and management by the candidate, have significant physical signs present, and have active unresolved problems to allow something to talk about. It's important to know that stable, uncommon conditions described by well-rehearsed patients do not generally make good long cases. So I think it's time. Your old faithfuls are great if you've got them and they've still got a few hot issues, but I think we need to populate and them with newer cases with more acute issues. Patients and guardians must be able to give a fluent and concise history, and patients must not be able to participate must be able to participate for either the full morning or afternoon cycles, because there's just simply not enough time if a long case goes home halfway through the afternoon for us to see another one. Most will be outpatients. However, current inpatients can be suitable and have been used in the past on many occasions. For each long case patient, a list of major diagnoses and issues without details should be provided for the examiners, and they may be, they're usually typed. There's no need to provide more extensive documentation. Okay, next slide. And a suitable short case generally have long-standing physical signs that can be clearly detected by careful and thorough examination, although patients with acute illnesses can also be used. They need to have clear signs that are not likely to have disappeared on the day of the examination. Short cases that rely on a spot diagnosis with little to examine systematically should be avoided. There should be some diagnostic challenge and opportunity to extend discussion. So we'll create the STEM as examiners on the day, and it's just the patient's name, age, system to begin examining. This should not include the diagnosis or any further details. However, choosing a system that carefully helps the examiners to target their examination in the limited time available to exam day. Okay, next. The complexity of cases. Common medical conditions in the community over rare conditions. Yeah, that's common sense, isn't it? You don't achieve much with a rare diagnosis, and it doesn't allow a candidate to demonstrate their knowledge and their prioritisation of important issues. Very rare conditions may limit the impact of discussion and are difficult for candidates and examiners. Long case patients who are too well rehearsed do not provide a realistic setting and may reduce fairness. I agree. No specific number of medical conditions are required in a long case patient. So one major problem with complications and consequences of therapy is adequate. Stable conditions are acceptable, particularly if there are questions about future management. And rare short case diagnoses may pose difficulties in standard setting. That's true. Okay, good. Next slide. Reserve patients. We all know this, most of us having organised the exam, is that some people just fail to attend on the day. So it's a good idea to have some backups, and 25% is reasonable. These patients must be brought to the examination area at the start of each cycle to avoid time wasting if required at short notice. And yes, as I said, Leo should maintain a reserve of at least 25%. And prime these patients that they may well sit on the bench all day. Some of them get quite cross when that happens, but I think it's just important. Good. Next slide. And these are tips for patient selection. So once again, ensure that they're able to be examined by the examiners and two candidates, and that they're prepared to stay for the full 4 hours. If they even a shadow of a doubt, for goodness sake, do not bring them in, no matter how good they are. If you're unsure as to the suitability of a patient, please seek advice from a NEP or a SEP or a local regional examiner that's done it for a while if they're suitable for the exam. Ask other Leos in your network for advice, and some states have WhatsApp groups and spreadsheets to enable sharing of patients and other helpful resources. Just obviously be mindful of privacy issues there. Okay, and that's just a little guide down there. So to organise your day. Next slide. A room and map setup. So clearly this keeps teams all in the same area, which is a good idea. I think I was caught out at a hospital last year where they hadn't set up the room with a desk, 2 chairs behind that desk and a chair in front of that desk to allow a nice interview to take place. It was rather cramped. The computer wasn't able to be used by us, and we had to move a lot of furniture very quickly to make it presentable. So please organise that before, or preferably the night before. That's about it, really. That's fairly self-explanatory. Okay, next slide, please. Medication lists, they should be accurate to maybe the last week or so. Keep your patients well informed and just ask them if there have been any changes over the last week or so to leading up to the examination. I think it's very important that all of the LEOs and DPEs advise their trainees that are sitting this exam that the medication sheet, although every effort is made to make sure that it is accurate, may not be. So to check those medications as they interview the patient is very important, and a superior candidate will identify medications no longer used and the reason why. So just let all of your candidates know that. Good. Next slide. It says here to provide hard copies of relevant imaging for patients, noting that reports should not be provided, and avoid providing soft copies as they may be difficult for examiners to access. We usually, obviously, a login to the local hospital's X-ray software is probably going a bit too far, but you can save a picture on a PDF file or a PowerPoint presentation right in the center of the screen with an easy log on for the examiners to re-log on. I think that's reasonable, and we've done that's worked quite well in the past. If the software fails and we can't get the X-ray up, then just ask them, we will ask them what would they look for in an X-ray, had it be available. For short cases, ensure that blank stems are available for each patient and only provide an indication for the body system to be examined. Do not provide a stem that's created by the examiners. Okay, and oxygen saturation should not be provided for any patients. Candidates will be advised they should prepare for basic observations and are limited to what they can measure. Next slide. Righto, so that's just an examination assistance movement table. So I guess make sure that the exam assistants can follow that on the day. Is there anything that was a previous slide that we? Okay, no, that was it. All right, good. Sorry, what was that?
Andrew, I'm happy to take the next few slides to give you a break if you wish.
Oh, thank you, Walter.
Okay, thanks, Andrew. So first of all, thanks everyone who Leos and everyone else who's on the call, who really will be the backbone of our exam. So thank you so much for helping with the 2025 clinical exams for the adult medicine examination. So Andrew's from Queensland. I'm based in the ACT. My name's Walter Abayrat, and I'm one of the senior examiners. And I'm going to go through the examination assistants. It is really important that the examination assistants know what they're doing and take that role, which is basically to take the logistics of where a candidate should be, take that onus so that the candidate doesn't have to worry. Andrew, you'd agree that when we're examining on the day, the last thing we need is a candidate who is extremely worried about where they have to be next. It really detracts from their concentration and gets them very flustered. So I'd be grateful if you could choose the examination assistants carefully and get them involved over the coming weeks, not just for selection of patients for the day, but also to understand the next few slides. It's key that you have someone who's your trusted person to do the bill. It can't be you. You're going to be busy doing a whole lot of other activities, Leos, lead examination organisers. It has to be someone you trust implicitly. The bell goes wrong, the whole day gets a bit wrecked. So please get someone you trust. This schedule, this movement schedule, is really to guide the assistants so that they're taking the role of going with the candidate to the next station. So next slide, please. It's really important that you give them the information sheet and the movement schedule that's relevant to them for their candidate, because remember, their candidates may start with shorts or longs for the day and their schedule will be different. So it's important that you give the right examination assistant the right movement schedule. You will have all of this sent via the weekly emails and on the SharePoint there. So please share with the examination assistants the relevant documents. We normally, as NEPs and SEPs, have a discussion with the examination assistants. Sometimes on certain days, everyone's busy and it doesn't get done. So what we've said here is that the responsibility for the pep talk, we're going to leave to you or a trusted person on the morning of the examination, getting all the assistants together and using this script for a briefing, preferably done by the Leo, but it will also be done, I think, by the one of the lead examiners of the day or the regional examiner. It's so important that they get the map layout in your region and just understand where their candidate will go. So they should do a walkthrough many times is my preference, to make sure they know exactly where things are. And if you get your map layout right, they shouldn't have to be walking from one side to the other. They should be walking as little as possible. So if you could make sure the map layout does allow a candidate not to have to move from one side of your area to another, that's too far. They cannot, examination assistants should not assist candidates except for what's allowed. And I'll go through that in the next slide. And that includes, please do not get them to hold timers or even hold some of the bags and materials, because in the past, it's been a source of concern that candidates have actually appealed on the basis of the examination assistant not doing the right thing. Take that onus off and make sure that in your region that your candidates, as they're training, understand that the examination assistants will not time keep. They won't hold their bags for them. They should get used to the as part of their training for the examination, they should get used to the timekeeping themselves and also managing the bag. Implicit in that is in the layout for the room, please make sure there's somewhere for the candidates. Laura, I've seen your posting. I'll come back to that now. Just make sure that there's an area for candidates to place their bag near to where the examination will be, if it's a bed or otherwise a chair. I'll just go to Laura's chat. Laura says, just to clarify, so exam assistants can't hold briefcase or equipment at all, even entering, exiting the room. The short answer is no, but I'm going to go through that next slide, Laura. Remind examination assistants that all examination material is confidential and they should not carry any notes with them home. Everything that is in the room at the end of the day should be given from the candidate back to the Leo so that it can be destroyed as per the college requirements there. Another chat came through. Can examination assistants help with neuro exam, walk the patient? I'm going to come to that. Good questions. Next slide. Okay, so this comes to the two questions that Laura and I don't know who the other one was, Samir asked. So what they will do, examination assistants escort the candidates to the rooms and know exactly where those rooms are and the timing. Remain close to the examination rooms should the candidates need to report incidents. Vital. So they're the conduit between the candidate being examined and you as Leos. And you as Leos then report incidents to the chief examiner of the day, who's allocated for that job. And that person then is tasked to ensure that any requirements, technical or otherwise, are undertaken and recorded and reported, so that there's a fair process that's undertaken after the exam, should it be required. The examination assistants should assess with anything related to issues before or during the exam for the candidate. Knock on and open the door at the end of the patient interview for the long case, just to make sure the timing of movement is ensured, not the timing of the long case interview, but the timing of movement, so that someone doesn't lose track of time and they know that they have to go to another place and follow the examination assistant. And then follow the timings indicated in the movement schedule. What they shouldn't be involved with is, and you know this when you are doing your own exams, don't look like you're happy or sad, the assistants, because you, believe it or not, it's amazing how the candidates take those facial expressions to heart and can really put their performance off. So neutral face, communicate with the candidates when they're with the examiners. They should not talk to the candidates in any way. Assist with the timekeeping, as I said, holding of timers, and then assist with patients during the gate examination. It's the responsibility of the co-examiner to assist with the patient. So that's something we've clarified this year. It has been updated in the Leo manual version 2. So in the past, and we've had, in fact, even last year I asked the examination assistants to assist, but now we are making it very standardized that the co-examiner will assist the patient during the gate examination. Provide feedback on performance or share any details in between examinations, like you're going well, keep going. Don't do that, please. Retrieve, holding, or handing the candidates the equipment. So going back to Samir's question, which was specific to neurology, neuro exam, walk the patient. Samir, are you okay with that? So don't walk the patient is what we're saying. The co-examiner does that. And Laura, just to clarify, that no holding briefcases or equipment. The exception is this. Let's say that the candidate leaves the room and they've forgotten all the equipment. On that occasion, I think it's fair to say you can pick up the equipment and then follow the candidate and give it to them. That's the only exception at the end of that case. Is that clear? Any other questions people want to unmute and ask? Okay. There's questions and answers at the end. Next slide. Okay. We have to be very clear in terms of the candidates' understanding of what they're participating in and what the rules of engagement for this. So maintaining confidentiality. We've had some unfortunate experiences where materials related to patients are taken out of the exam, and that is a privacy issue. It's really important that we declare conflicts of interest. So if you know the examiners, the candidates should say. If the examiners know the candidates, they have to say to the lead examiner and also the lead examiner for the whole day that they have a pre-existing knowledge of the patient and describe that, and they have to take action. So similarly, the candidates should declare conflicts of interest. And there's a training, integrity and training policy that the candidates sign that they have read. Just make sure that the candidates sign the agreement, please, before the start of the exam, and send that to the assessment services team via email after the exam. Next slide. This is important. So as LEOs, it's really important to provide this information to all the candidates. Ideally, you have a gathering area for all of the candidates to assemble. And then once you have everyone there, if you could please welcome everyone and go through the exam layout, providing a quick summary. In some places, there's a walkthrough. I don't think that's a bad idea. Just making sure that that you're careful that patients are not outside. So if you can make that summary of the examination area without doing a walkthrough, great. But if things are tricky, I'd rather you do that and just make sure the patients are in the rooms. So there are no clues that are ascertained before the actual exam starts. Important to know where bathrooms are and where the eating areas are, so that people are able to go to those areas when they can. Please read through the statements regarding safety, and I won't go through the statements. Please read that, but basically it's important that safety for the candidates is vitally important, and that if there are any incidents, that the incidents are reported as soon as possible to the LEO, either via the examination assistants or directly. That remind them about the oxygen saturation that won't be provided, and that'll be part of the clinical examination. And in terms of incidents, to ensure that if any incidents occur, that is red flagged. There are times where the examiners will ask, for instance, in the long case, if there are technical issues that we obviously don't see because the interview is done one-on-one. And in the clinical examination for the short case, we can see if there's a technical issue, we red flag that, we red dot that. But if the candidates want to state their issues, they should do that to the LEO. Next slide. No, is that slide moved forward, Danielle? Great. So this should be in your guide, but permitted stationery and equipment there. Everything that is on there listed can be brought by candidates. If it's not there, they shouldn't bring it. I won't go through every single dot point. Nothing much has changed this year. During COVID, we talked about ophthalmoscopes and horoscopes and otoscopes, but essentially, if anything is required in terms of examination for the clinical examination, it's listed there. Next slide. We have revised this section. Again, it should be in your updated version of the LEO manual. We talked about dress code in the committee. So we talked about scrubs being permitted, and we ended up saying, look, this is a professional exam, and that we are going to continue with the dress code of no scrubs being permitted, but wearing professional, comfortable clothing that allows you to move freely, bare below the elbow, recommending no suits, ties, jackets whilst examining patients. The jackets may be worn for long case presentations. And the watch shouldn't be a smartphone, or smart device, I should say. Analog digital watches are allowed and recommended, obviously, for the clinical examination requirement. Personal items, the mobile phone should only be accessed during lunch breaks under the examination assistant's supervision, and then stored again. So my recommendation is you collect it in the morning, have an area where people can get their phones during the lunch break, and have the examination assistant there during lunch break with the candidate. They require to bring the digital printed or printed version of the candidate allocation email and the photo ID, which could be the driver's license or a passport. Digital IDs are not accepted, and candidates will know this. We talked about the allowed supplies. It's on the previous screen. Food and drink, they can bring water in a transparent, unlabeled bottle. Bit details about how it smells. Quiet food in a small clear container, consumed only between cases. They can do that, and there are medical reasons why people would need to have their food in between cases. Medication must be in a Ziploc bag with name and candidate number, and kept with you at all times during the examination. Next slide. We've talked about mobile phones, just to reiterate there. Next slide. A few. There you go, Alexander. What is the requirement to supervise access mobile phone during lunch breaks? Candidates often go off site. Yeah. Are we not allowed? Yes, is a short answer. If they go off site, a bit unfortunate if they need to go off site, because there's a risk there, Alexander, that they get a bit lost. So I would strongly recommend that they don't go off site for lunch. Of course, going for a walk around a small area there, yes, they can, but they can't take their phone. It needs to be under supervision, Alexander. I hope that's clear. Catering. In the past, we've kind of been a little bit silent on the candidates in some years, but we're not this year. Please cater for the candidates. They should have an area separate from the examiners as far as can be, please. We try not to talk about the cases or the candidates, but occasionally some of the newer examiners do talk initially, and then they're shushed by the more senior examiners. But we don't want the areas to be adjacent to each other. Cool drinks, tea, coffee, light lunch with a vegetarian option is recommended, so that it's suitable for all candidates. Patients should have morning and afternoon break refreshments, and examiners, of course, will rate your site according to the quality of their catering. Unfortunately, not just the quality of the candidates and the cases. So just make sure that the timing of all the meals and coffee breaks are sufficient, such that examiners can pop in. Sometimes during lunch they have to catch up with their digital entry, so just make sure that they can take their food, if required, back to the room. Naz, you put something in there? Yep, just a reiteration of that. Yep.
Yeah, just to add some detail about the mobile phone question.
Thank you. Catering, as I said, needs to be tightly organised, time constraints. The There's only a 10-minute break for examiners for the morning and afternoon tea. Some don't even come out when they're running late, but some just pop over, grab their coffee and water, and then go back to their room to continue with the digital entries for the cases. There's only 30 minutes for lunch, so if you could just make sure that the catering is on time, and that you've got a person who's ensuring that the caterers can call if there are problems, and that you can call if there are problems, so that they can revise their timing. Order the trolley for 30 minutes before they're needed. Just make sure they're ready on time, and order separate trolleys for the examiners, candidates, and patients. Next slide. You will all be provided with communication from the DCE support. From the 14th of April, these emails will be weekly. So if you go 14th to the 21st, 28th, there'll be a focus on some of those emails on the topics that are listed there. So introductory email, medication list, examination assistance, radiology images, short case STEM, so that you'll be walked through each week. So if you could just ensure that you've read those and your team understands the content of those emails, and that if you've got any queries, that you do contact your regional examiner and or the DCE support team. Next slide. This is a reiteration about examination safety. As in all clinical practice, safety is a priority. It's important, if anyone at the examination site feels unsafe at any time, they should stop and immediately seek help. Please note, for candidates, this will not adversely affect their examination assessment. So there has been a trend in recent years where we've seen candidates report two things related to safety. One is this sort of, and it's unfortunate, you can't vet this when you're looking at participants for the exams, that there's sexism or racism or both. It's really unfortunate. We get that, unfortunately, in our everyday practice, and we have to deal with that, and that's part of our professionalism. But it's, of course, very unfortunate when it occurs during a highly stressful occasion, particularly if there's a bit of passive aggression going on and some of the questions in a long case are being resisted. So our only advice is, I mean, if your team can select out people who are likely to be difficult during the long case examination or even the short case. However, in the short case, at least there'll be a group of examiners who'll be there present. In the long cases, it's a one-on-one interview. That's the best we can do, is to just make sure that we don't get the wrong patients who really wouldn't be suitable for that scenario. We do tell, in our response to correspondence after the exam, we tell candidates that really this is part of everyday medicine that we have to deal with, and it is professionalism, but it's an unfortunate thing if they have to deal with it on the day. Next slide. Incident reports, just going over what we've already done. As Leos, please complete an incident report for any and all incidents, including in the event of unusual disruptions, such as delays affecting multiple candidates. And that could be because there's a need for a pause whilst a candidate or examiner or patient has a medical emergency. Patients who bring pets or support animals to the DCE. So, if that happens, and sometimes it's good to obviously make sure that if that happens, that there is some catering for that in terms of allowing an area that, let's say there's a dog that is brought in because of visual impairment. first of all, is that the right type of person to bring for the exam? And secondly, just making sure that there is an understanding that that could be a difficult station. If a patient leaves the examination early, or if there's incident reported by examiners or candidates, so please start that incident report. As an examiner, and particularly when we're chief examiners, we tend to do that, but your support to complete those incident reports would be great. Even if they seem insignificant on the day, it certainly can be distressing to the candidates. And some candidates may not look distressed on the day, but as time goes on, that distress builds. And it's certainly something that we see a letter for special consideration, where more detail on the incident, the better. We use that for our reviews and appeals. Next slide. I've gone through the conflict of interest. For the DCE team, it is something, Andrew and I talked about this yesterday when we were going through the slides just before today's presentation. I think it's something that we should bring up in the calibration, NEP-CEP calibration, because I'm pretty sure that not all the NEPs are aware that when there's conflicts of interest, it's not just dealt with, but it needs to be recorded. If there's a registrar who has worked with the hospital staff or the examiners in the past, it needs to be recorded. It also needs to be dealt with at the time, and an example would be the lead examiner may change for that case. Ideally, when we get our list the night before or 2 nights before, the examiners get a list of the candidates. I generally take a look through that and see if I have any familiar names, and then on the day we try and deal with it, or I try and change my my team to avoid that candidate. So ideally sooner than later, so we can change teams. Now, for you as lead examiners, that may cause problems. For instance, I'm a cardiologist, and you may have put me in a team that doesn't actually put me at a risk of examining my own specialty with the long cases or short cases, and then that may muck your schedule up. So just keep an eye on those issues. If someone emails you and saying that I shouldn't be in this team because I know this person. Next slide. Now, there's quite a few. Chris Swan. There was a discussion during the DP session last week about whether or not examination systems can walk beside the patient, stabilize them again. Some examiners are like, yeah. Yep. So Chris, it has been. We discussed this at one of our meetings, and we put it into the manual. We're getting our second examiner, or second or third examiner, to do that job of assisting the patient with the gait. Oh, you've already answered that, Naz. All right. What is the requirement to supervise access to mobile phone during lunch breaks? Candidates often go off. Oh, I've already read that. And are nurses allowed to be examination assistants? I've never had that question before. Right? Yes is the short answer. There's no reason why they need to have a medical license, but what a great opportunity to be examination assistant as a medical student or a junior trainee. And I'd certainly be trying to get our medical junior colleagues to be involved. But if you couldn't, I guess they could. There's no real reason not to. Did you say they can? Yeah. Rohan says, sorry for the examiner. The examination assistant. What's that? Are there certain things that candidates are not allowed to do on their phones? Lunch break? Yeah. Access the internet is one. Not because we think they will get anything out of it. It's more that they actually look things up and they get distressed. So rather than thinking about the past in the morning session, we want them to get themselves ready for the afternoon session. And I keep telling our trainees, look, you cannot assume any mark is being attributed to you. Just treat each case as an opportunity to improve your mark. We don't want them to think about the morning sessions by getting on the internet. Okay, special considerations. So just for your information, we have a process of looking at special considerations before the exam and then after the exam. If candidates have a permanent long-standing impairment, a physical disability, for instance, or a temporary impairment with medical grounds like a fracture that causes a physical disability, or religious commitments, we have asked them to notify us in time so that you can be notified, and you then notify the examiners for the day, and that's taken into consideration with the exam in terms of how we set up the room, for instance, and how we examine the candidate. The post-examination, as Andrew said, Dr. Sloss said that 5 days after the examination is the period of time. That's the deadline. So after that, 5 days passes, the candidate cannot put in special consideration requests. Those circumstances under the policy, and there is a policy on this, very clear, and we use that policy as our guideline when it comes to the committee for consideration of technical issues or a temporary impairment that did cause performance issues during the exam. Now, stress is not a reason, but nonetheless, that's not your role. You need to be just telling the candidate that they've got 5 days post-examination if they come to you and say, look, I need to put a special consideration, and it's well delineated as to where they provide that information and how. Next slide. Yep. One important thing to note is that the marks are never changed. So when we look at the special consideration, we are not in the committee, the DCE clinical exam committee is not able to change marks. But what they can do is have special consideration for sitting again for the exam as a supplementary, or there are times where special consideration includes not counting a fail on the record, which obviously does change future attempts for the DCE. The cap on that. Next slide. Reimbursement. I wanted to really thank the DCE support team because they did a great job, I thought, communicating the reimbursement issue. There was a blowout a few years ago in the budget for reimbursement for the clinical exam from hospital staff, from hospitals. And in order to do that, there have been guidelines for each of the components of the reimbursement that are allowed. Having said that, last year it was I think it was the first year we used it NAS, and there was every attempt of responding to people who thought it was unfair and providing a good reason for why the cap for the amount was exceeded. As a consequence, the college has looked at the spread of the requests for the reimbursement of costs, and there has been an increase of about 22 to 29% for the reimbursement. It doesn't mean that you can't still provide a request for additional funding should there be a good reason. but hopefully there'll be less of that this year. And further information will be provided directly to the hospital via an email. Next slide. So maybe we'll stop sharing, Danielle. And now, if people want to ask questions, put on your, if you're comfortable, put on your camera and put your hand up. Clear as mud. Nat, do you have a question? Or Samir, do you have a question? No, all good.
Can I ask a quick question? Can we access these slides afterwards?
Absolutely. Yes, absolutely. We're going to get the recording popped up on YouTube via a membership password, and we will send the recording and the slides after in the next couple of days.
Yeah, excellent. Thank you.
No problems.
Michael.
I just had a question of what the best way to how to communicate subsequent questions going forward. Is email the best? Is there a direct number we can call instead of the 1300 number?
So the easiest way is to just send an email to dce@racp.edu.au. There's 5 staff members that the specific questions are triaged to. So every single person in our team has a responsibility related to the different facets of the DCE. So you will get a response from an actual person and not a pre-recorded kind of message. The best way to contact us via phone is the 1800 number, and then they will triage to whoever is actually online at that time. And also please note that some staff members, we do work like in the evenings. So you may get a response from us during this time over the next 3 months, a bit after hours, maybe 6, maybe 7, sometimes 8 o'clock, is because once we open up the help desk function, we continue to work and respond to queries and that kind of thing.
Thank you.
Thanks.
No problem.
Thanks, Naz. Jen, the question about reimbursement amount, including weekend penalty rates for wages. I mean, as you know, the vast majority of our examinations occurring on the weekends for this June month. So yes, it does. But I know that there are areas where the penalty rates for staff, particularly nursing staff, are quite significant. So if it is something that puts you above the cap, then put that information into the documentation to ask the college for consideration for more. And as I said, they're very reasonable. Then, Samir, you asked another question. SharePoint link does not work. Works sporadically for me. It's the same for others. Can it be fixed? Over to you, Sylvia or Naz. Have others said the same, or Rebecca?
No.
You're on mute, Beth.
You're on mute.
Apologies, everyone. My dog felt the need to say something. So apologies as well for the first issue with the SharePoint link. It should now be accessible by everyone. If you are having issues, my first point of call or suggestion would be to try using an incognito window and copying the link in there. If not, please send through an email and I'll have another look. Apologies again. We've moved to the SharePoint system this year, so I really appreciate everyone's patience while we work out the teething issues.
Mm-hmm. Simon says there's a brief example on the slide that Andrew presented what the spreadsheet looks like and how to match candidates to patients' partners for the exams. Where would they be moved? Timing. Now, Simon, do you want to go off mute and just explain that a bit more? Because I'm a bit
Yeah, of course. Can you hear me?
Yep.
Okay, awesome. No, thank you for that. There was I just saw a brief part of a spreadsheet that had a kind of a pre-populated like number of candidates and then a box that you would type the number of candidates in, and then it would allocate patients towards the candidates. So
yep.
Is that something that we have access to, or do we do this manually?
You do have access to that. That's actually on the SharePoint, and there is a spreadsheet there for 8, 12, and 16 candidates. So once you populate the top section, then it follows through. But if you do have any issues with that spreadsheet, please let us know, and we can, you know, fix it or something like that if there's a formula off or anything like that. But generally, we've used it the last couple of years and it's worked fine.
Excellent. Thank you.
No problem.
Andrew, rather
Yes.
Simon, I should say, people have used that also to sort of look at the flow. So you can do that several ways. One is with consideration of the candidates, that they are getting a good spread of cases.
Oh, okay. Yep.
Yep.
Yes.
So long case, short case, good spread. And
Couldn't agree
secondly,
more, Walter.
yeah, it's really important that people look at that, because, you know, it'd be unfortunate if you get, you know, 3 or 4 of a subspecialty short case and not a lot of variety in terms of the type of long case. The second thing is to ensure that the examiners don't examine on their subspecialty. So you get that opportunity when you get the list of examiners coming to your site. Nat says, will the college be distributing examiner beverage? Dietary preference is really helpful. I think they will. Yep, they will, Nat. Any more questions? All right. Thank you again for being so helpful with the process this year. Without you, we couldn't run it. So thank you, everyone.
Yeah, thank you very much, everybody. And Naz, Danielle, and Sylvia, thanks for the support. Thanks, Walter.
Yeah, Andrew, thanks a lot. Bye.